Hello and welcome. This is Rith Basu from Woodlands Hospital. Hernia surgery is common, but what many patients tend to worry about is what stays inside the body and for how long. To explain this, new advancements in hernia surgery, we're lucky to have with us Dr. Sumnatra Ray, Consultant General Laparoscopic Surgery, Woodlands Hospital. So we'll go straight to the questions. In simple terms, what is a mesh and what is its use in hernia surgery?
In any hernia surgery, there is a gap inside the abdominal wall and we need to cover this gap and we cover it with a mesh. Mesh is a scaffold that actually give the reinforcement to the abdominal wall and it acts as a scaffold for the newer tissue ingrowth, and that actually repairs the abdominal gap through which the hernia is happening. And this mesh can be of different types, and generally the mesh we use tend to stay inside the body, gets integrated into the wall of the abdomen, and it stays permanently in general. So this is all about mesh.
And we also have resorbable meshes, as they call that, dissolved in the body. So if you could tell us about that, because that is used in Woodlands.
Exactly. I mean, that is a new kind of thing, that the purpose of the mesh is for the tissue reinforcement. So something new has come out, that once the purpose is served, then the mesh gets resolved inside the body. Now, this can be done for specific indications in specific cases. It's not like meant to be used for in every case patients, because in some patients we need to keep some the scaffolding structure to stay for permanent. We intended to keep those things for permanent. In those cases, it's not meant for that. But in specifically young patients, in patients in the childbearing age group for females, and in patients with infected media, so in specific indications, we intend to use some resorbable meshes that after use, it gets completely resolved inside the body. And this is a new trend.
So are there different types of resorbable meshes that are used?
Obviously, like some are synthetic meshes, synthetic resorbable meshes, and some are biosynthetic resorbable meshes, having their resorption duration, variation in resorption duration and strength.
So how long does it stay in the body?
Exactly. Basically, mainly two of the bioresorbable meshes are in use. Specifically, mainly the Phasix and the Transorb, the new arrival, and there is wide variation of this duration. Like for Phasix, it's around 12 to 18 months, and for Phasix, it's 18 to 24 months, and for complete resorption, at least maximum 5 years.
That's what Transorb.
Transorb, yeah.
Since when are these resorbable meshes being used in Woodlands?
I mean, Woodlands has been the pioneer in this use of new kinds of meshes. Just let me tell you one this important thing, that as far as the Transorb is concerned, we are the first in India, rather we are the first in the world after USA, we use the Transorb.
Right.
And for Phasix, I mean, we are the pioneer again in Eastern India, and probably the second time that we have used in India, all over India. So Woodlands has always been the pioneer adopting new technologies.
And so you touched upon it, but just again for our viewers, if you could specify exactly the kind of patients on whom these resorbable meshes can be used.
Exactly. Say for in young female patients of the childbearing age group, a patient presents with a hernia, and the patient might have another pregnancy. So there's always a bit of
Like people are uncomfortable with the foreign body.
With the foreign body,
and
and when you are just having that, you might have a second operation again. So I mean, if the foreign body stays inside, I mean, it's difficult for the second operation. So in those patients, I mean, a resorbable mesh, after serving its purpose, it gets dissolved. And in specific, another indication is for physics, which is in infected media, like when the hernia gets obstructed, strangulated. Generally, the principle is not to use any mesh. So in those cases, we can use physics, even in the infected media. We can use mesh, and the operation can be done at one go, which would have been done in a two-step way with conventional meshes, but it can be done at the one go.
Thank you, doctor, for explaining about advancements in meshes so clearly. Innovations like these show that surgery today is not just about fixing the problem, it's also about long-term outcomes, it's about comfort. This is Rith Basu signing off. Join us for our next live.